Incident is really scary for athletes and for their parents, and 7 News is on your side with expert advice on these types of issues.
Joining us now is Dr. Susan O'Donoghue, cardiac electrophysiologist at MedStar Washington Hospital Center. Dr. O'Donoghue, thank you so much for joining us. So James is only 18 years old and a top athlete. A lot of folks at home wondering how could something like this happen. I know we don't know all the facts and circumstances of this situation, but what are doctors likely looking at?
The doctors will be looking for either a structural or an electrical problem with his heart that made him susceptible to a sudden rhythm problem.
And is this something, I mean, obviously for someone that young, it's not common. How often do you see something like this in a young, healthy athlete?
Yeah, well, there are about 150 or so sudden cardiac arrests in athletes each year in the United States, so maybe one every 2 or 3 days. Now, to put that in context, there are about 350,000 sudden cardiac arrests overall in the United States. Of course, most are older people, but we do see it in young people, athletes and non-athletes. And what we're always going to be looking for is, of course, the reason. And as I say, it's usually an inherited or structural problem of the heart, although sometimes it's an acquired problem. But usually there's something either structural or genetic that puts the person at risk for rhythm instability.
And there would be no previous warning signs to something like this, right?
Not necessarily. Sometimes there's either a family history that suggests an inherited problem, or the athlete has previously had symptoms, either dizziness or palpitations or some other sign that something is amiss.
So it would be important for anybody watching this to really take anything like that seriously, any family history, any issues they may have, and don't just brush it off, but get it checked out.
Absolutely. And with the imaging and the genetic testing that we have nowadays, we can generally identify these problems, hopefully before someone has a cardiac arrest. But even at this point, the problem can almost always be uncovered and treated.
It's really remarkable and really good news to hear that Bronny is out of the ICU so quickly. Can you talk, though, to the importance of CPR and proper training in situations like this?
Absolutely. And what's made a huge difference in the survival, particularly of athletes, is staffs who are trained in CPR and the availability of AEDs, automatic external defibrillators. And there's a big campaign. In fact, MedStar has a big campaign right now to teach people CPR, which has become very simple. And we have a video where you can learn CPR in 3 minutes. So no one should be afraid to administer CPR. And no one should be afraid to use an automatic external defibrillator if there's one available. That really will save lives.
Yep, same message we heard after everything that happened with Damar Hamlin, and it's good to just say this once again to everybody watching. Dr. Susan O'Donoghue, thank you so much from MedStar. We appreciate it.
Thank you.